Let's start with a quick overview of why you're here tonight. There is no doubt the NDIS is a great reform and one that will deliver much needed funding, but there is genuine concern it won't work for everyone. The New South Wales Government has announced that they will stop providing all disability services by 2018. This decision was made without any public debate or consultation. This decision will have far-reaching consequences for the disabled community in New South Wales and to those who currently provide those services.
Over the last few months, it is with unfolding horror that we've realised that a scheme that was to be celebrated has quickly become a point of major concern for nurses who work in the sector and their clients and the families they care for. By fully privatising the disability sector without stakeholder or community input, this government has clearly stated its intention to drown out the voices of some of the most vulnerable citizens and their spokespeople. Where is the choice for those currently in ageing, disability and home care facilities who are happy with the choice of public provision? How are the disabled with severe disabilities and challenging behaviours able to make an informed choice? Where is the choice for nurses and others who want to remain in the public system and are instead being coerced into a private entity? Shouldn't the real choice be the choice between public provision and a private entity, between highly qualified nursing care and a care setting that might not even include qualified nurses? What would you choose if you had the choice?
The state government is acting inconsistently with the NDIS principles of independence, inclusion and choice. Now, I don't think there's anyone in this room that would dispute the fact that we are talking about tonight the most vulnerable people in our community, and that the workers providing the care to those vulnerable people. It also runs contrary to every fundamental legal principle whereby we are all autonomous individuals who have the right to make decisions affecting our lives, including who we choose to work for and on what terms. Forget collective bargaining rights, not even individual bargaining rights are allowed in this occasion.
Our profoundly disabled people at Stockton, some of them are blind, some of them are deaf and blind, some of them can't move at all, and they can't talk. It's outrageous to think you can just uproot them and move them. We cannot allow politicians to do this to our people.
We are all willing to negotiate. If we're given something to consider and if we're given information, but we're not given anything, and that's why the fear is within us. At a meeting I said to Mr. Ajaka, could you tell me what the plan is? And he said, that will be negotiated. And I said, you just said that there was a 20-year plan to close Morisset, Stockton and Tomaree. Now you're telling me you haven't got a plan?
I'm one of the 5 doctors at Stockton Centre, and this is the first time I've spoken publicly. I know all the doctors are very, very concerned. Now, when I asked John Ryan about some very basic information about his plans and his management and what he'd be measuring for the medical care of these people in the community, he was unable to answer my questions at all, basically. I was stunned at his ignorance, absolutely stunned by his own admission. John Ryan says he didn't really get his head around how complex this situation was. And I offered a compromise model. I said, well, you know, if this goes ahead and if you do relocate all these people in the community, can we keep the medical model, you know, in terms of the clinic and the allied health and the doctors and all this expertise that's taken decades and decades. These nurses that have, you know, nursed these people from when they were babies, they know what the twinkle in the eye means. I rely on these nurses for their diagnostic skills. Without them, I couldn't do my job.
Stockton staff have been informed that negotiations have commenced with regards to keeping our nursing positions and our conditions. Could you just tell us what the government's come and said, what negotiations they've started?
They do not have a position or a decent plan about how they're going to address the real issues that we're facing industrially. They're not fulfilling their obligations that they committed to consult and to work through the issues quickly.
We must fight to keep these people in the right place that they belong to. And I'd even go as far as to suggest it's an act of abuse to put them in the community and do what they're going to try and do.
As a message to the Minister that he's got to do better, he hasn't met your expectations, and I'd certainly say that it is a worthwhile message to send to a Minister that he does not have your faith, your confidence in it. So over to you. All of those in favour of expressing our loss of confidence in the Minister? Anyone against? I'm happy to declare it carried unanimously by this meeting.